Welcome to Community Health Matters. I'm your host, Amy Marsalis. On today's show, we'll learn about the human papillomavirus and the vaccine that prevents it, maternal health tips to ensure a healthy pregnancy and birth, and the different types of diabetes and how to live with or prevent the onset of diabetes. All of that coming up next on Community Health Matters. From the News Channel 5 network, this is Community Health Matters, sponsored by the United Health Foundation. Hi everyone, thanks for tuning into Community Health Matters. I'm Amy Marsalis, and today we're starting our program talking with Dr. Michael Warren, who is a board-certified pediatrician now with the Tennessee Department of Health. We're going to be talking about human papillomavirus in just a moment, but first we're talking about population health, which is a phrase, a term I had never heard of before. Would you elaborate on what that entails?
Sure. Folks have talked about population health for a long time. If you go back and look in the medical literature, there are descriptions there. But recently, as we're trying to think about how do we improve the health of people in Tennessee, we've got a renewed focus on this notion of population health. And the distinction is, if we think about the way that most people encounter health, it's through health care. So you go and see your doctor or your nurse and you have an individual encounter. In public health, we're really thinking about the entire population. So for Tennessee, that's about 6.5 million folks. And thinking about what are the main determinants of how healthy they are and what are the things that we can do to improve their health. And not just that 6.5 million people as a whole, but what about people in East Tennessee and West Tennessee and Middle Tennessee? Very different health pictures, very different landscapes, and where there are opportunities to improve their health.
There could be environmental factors, other things that have such an impact on their health.
Absolutely. So when I was in clinical practice, I might get 15 or 20 minutes with a patient, and I would say things like, you know, you need to be more active or you need to eat healthier foods. And from a population health perspective, we might say, we need to increase physical activity. Are there sidewalks in your neighborhood? What's crime like? Is it safe for you to be out? And really engage those community partners around making that community a healthier place for people to live.
A broader view, which is vital.
Absolutely, and the health care is critical. We are fortunate to have phenomenal health care in Tennessee, and I would also say to make people healthier, it's bigger than just health care.
All right, moving along to HPV, human papillomavirus. We know it's pretty common. Let's jump right in. How is this virus spread?
So when we talk about human papillomavirus, most people have probably heard the papilloma part of that means warts, and that's where most people have probably heard of this term. And it's actually about 150 different viruses. Some of them don't cause many symptoms at all. Some of them can cause very distressing symptoms like genital warts, and that's where most folks have heard of it. Some folks can actually get cancer from certain types of the virus, and so that's why there's really a great interest in thinking about how we prevent it. To your question about how it's transmitted, most frequently it's through intimate contact, so intimate partner contact like sexual contact.
Are you seeing that in the younger population more so than the middle-aged population?
So you can actually see it across all ranges. In fact, most adults have been exposed, most adults who are sexually active have been exposed to the virus at some point throughout their life. But certainly we know that once people become sexually active, there is a risk for contracting HPV because it is so common. And so as we think about how to prevent HPV and the complications that come from that, we really want to focus before people become sexually active at all.
All right, I know we're going to get to that in a second, but let's talk again about symptoms, signs. Are they always really obvious?
They're not, unfortunately, and that's one of the challenges. Many people may be infected and not even know, and so if they're infected and aren't aware, they could spread that to their partner without their knowledge. Some people do have very obvious signs. So for example, the one that is probably most distressing to folks would be something like genital warts. You can also see changes in the cervix, and so a woman might have that identified when she goes in for a pap smear, and they might see an abnormality. But again, that may even be not obvious unless she's having other symptoms that go along with it.
Okay, that dovetails right into diagnosis of this. So that would be a pap smear?
So it depends on the particular type of virus, but a pap smear certainly for cervical changes. For individuals who have genital warts, that's something you would identify on physical exam, and so you would see those and be able to identify them that way. But there are other types of cancer that can be caused by HPV, and there aren't really good tests for those until the person becomes symptomatic. And so as you're working that person up for whatever symptoms they have, you might uncover HPV as the underlying cause.
Are there good treatments for this?
For some aspects, so there's not a treatment for the virus itself, but for example, you can treat the genital warts. If there's an abnormality found on the pap smear, there's certain procedures that can be done to address cervical changes. And certainly if an individual has cancer, there are treatments that are available. There's a variety of ones and a variety of effectiveness as you look at those.
Are those oral meds? Are they topical kind of treatments, ointments, things like that? Or is it an oral medication? What are some of those things?
So it can vary, again, depending on the way that the virus is presenting. If you think about something like genital warts, you might be talking about a topical treatment, maybe even a removal of those. If you're thinking about changes in the cervix, maybe a minor surgical procedure where that part of the cervix is removed or treatment is applied there. Certainly if you're thinking about other types of cancer, it's going to depend on where that cancer is located and whether it's spread. So might be chemotherapy, might be radiation, surgery, might be a combination of any of those.
What percentage of these cases goes on to present itself as cancer? Have you measured that? Is there a number out there?
So it's hard to know an exact number. And so again, we always want to know that there's a chance of this virus leading to cancer. And so we want to think about, again, moving upstream and trying to prevent it before it ever happens.
How can you do that? How do you prevent?
Great question. You know, in public health, we often think about prevention. We think about things like vaccines. How do we prevent disease before it ever happens? That really is the ultimate goal. And so if we think about preventing HPV, first and foremost, there's a vaccine, a wonderfully effective vaccine, very safe, and you can get that, both boys and girls, starting at the age of 11 or 12. And so as kids are coming in, that's about the same time. Typically, you're 6th or 7th grade, you're getting other shots like your Tdap. So for tetanus and whooping cough, you're getting a meningitis shot at that visit. This vaccine is just one more of those vaccines that you get. So it's part of that routine package of vaccinations that we give kids. It's still relatively new, so you and I didn't get it when we were growing up, but kids now get it, and it's just part of the bundle that they get.
Do many parents resist it? I remember in the past hearing that buzz about, well, I don't know if I want my kids to get that vaccine. Why wouldn't they?
There is some resistance. There's actually some concern among some parents that if my child gets this vaccine, maybe they're going to be more likely to be sexually active or sexually active early. There's actually been good studies that have been done to show that's just not the case. And what we know, in fact, is that kids don't start having sex earlier, but they also get that prevention. And so since this vaccine has been in place, we've seen a decrease in the number of cases of HPV and the types of cancers that are caused by HPV. So tremendous, and we think about it as a cancer prevention vaccine.
All right, very interesting. Thank you so much for enlightening us for this time here with us today. Dr. Michael Warren with the Tennessee Department of Health. We appreciate it.
Great, thank you.
All right, and we'll be right back with more after this. Dr. Karen Cassidy is my next guest today. Welcome back. You were here a few months ago, and today I know we're going to talk about maternal health, pregnancy being one of the most exciting times of a woman's life, a family's life, but also extremely overwhelming. What is United Healthcare doing, Dr. Cassidy, to encourage healthy births?
Yeah, so we've got great, obviously, services for women during their pregnancy and then for young babies once they're born to make sure that people are getting all those wellness checks and things that they need to do to make sure they're engaged with their physician and healthy. We've also got some very specific support programs. So actually, a United Healthcare member could go onto the United Healthcare website, and there's actually healthy pregnancy programs where they can actually have nurse support and be plugged in so that they, can get their individualized needs met to make sure they're not feeling overwhelmed and they can make good choices to have a healthy pregnancy.
Great support for them through this. Very important to carry that baby full term, if possible, to 39 weeks. So don't schedule early delivery for convenience sake, right? Is that part of the message?
We have such a high C-section right here in the United States, and we do think a great deal of that is related to people scheduling inductions or, quite frankly, scheduling their C-section because they want the OB that's been seeing them through their pregnancy to be on call the day they deliver. And, where I understand that relationship issue, I think you really have to be conscious of the fact that C-sections are really tough on moms. It's a major surgery. There are some complications that babies have related to C-section delivery. And then full-term babies are healthier babies. So if you can take your baby to full term, be patient, wait to go into natural labor, there's some real benefits to the baby as far as brain development, gaining some weight, making sure you have healthy, mature lungs before delivery. Real important time those last few weeks. So try to make it to term is a very good plan.
Do C-sections, when you say they can have an adverse impact on moms and babies, on the babies, what are some of the adverse effects on a baby through a C-section?
Yeah, so a baby born by C-section, sometimes they'll have some respiratory distress after delivery. There's that kind of squeeze factor from a vaginal delivery we think really helps clear fluids from babies' lungs. And then babies, if they're under stress related to surgery, they can swallow meconium, which is stool, which can cause problems. Not every C-section is an avoidable C-section, and there are some babies that have medical problems that need C-section. But a C-section for the sake of convenience surely is not something that would be in the best interest of the mom or the baby.
And you say that again, our numbers are much higher in the U.S. than around the world.
About 1 in 3 women, just over 30%. It's like 32% was the last statistics I saw for 2014. It's really high. It's definitely high when we consider, when we compare to other countries, advanced countries, Western countries across the world.
Expectant mothers can follow certain steps to help ensure they deliver a healthy baby. What are some of those steps? Educate us on some of those steps.
Yeah, so much of healthy pregnancy, they're the same things we talk about for healthy lifestyle. I think the difference is we really want you plugged in with that OB early and doing those prenatal visits to make sure everything's going well with your pregnancy. But a lot of the other stuff is stuff we talk about all the time. Eating healthy, getting plenty of rest, getting exercise. You absolutely can exercise through your pregnancy. Making sure you're a non-smoker. If you are a smoker and you're planning a pregnancy, working on quitting prior to getting pregnant is just really important. One of the major causes of low birth weight babies is tobacco abuse. And then alcohol consumption is something we recommend that you don't do during pregnancy. And then obviously illicit drug use would be something you want to not be doing during pregnancy. And reaching out and asking for help if you're having issues.
Let's discuss various birth settings and the risks that can be associated with where you have the baby.
So in this country, most people deliver in a hospital-based setting. That's not true in all countries. Some countries really do a lot of home deliveries. I think the important thing is that you want to make sure that you have an OB who's following you closely, and that if you're considering an alternate setting, your OB is in agreement that that is a safe setting for you. And then you really also want to check with your insurance provider, because there are some variations depending on health plans on what is or is not covered, so you want to be careful with that. So I think you definitely need good medical advice if you're looking at an alternate setting, and definitely to make sure that your insurance carrier is going to be online with that, and you'll have good coverage if you do choose an alternate setting.
This kind of works its way into the next question I had, really, to make plans to prepare for the baby's arrival, which could also include maternity leave and lactation kind of classes. Can you elaborate on those things?
Yes, we definitely strongly encourage breastfeeding. I think breastfeeding has a lot of benefits for a baby, particularly as far as their immune system development, but also for moms. I mean, when you're breastfeeding, it really helps to get that uterus clamped down and back into normal size. It helps women, some with weight loss, because you're using a lot of calories to make that breast milk. It can really be helpful to moms as well. Breastfeeding, I think the myth of breastfeeding, there's two. One is it's really hard and nobody can do it successfully, and the other one is it's natural and easy. And I think the truth really is in the middle. Reading some books about breastfeeding, taking advantage of lactation consultants, which are typically available at most birthing centers. They're really very helpful and can help you get started. And then, I think there is a little bit of a gap where some of us don't have moms who breastfed anymore. But if you have a friend, a mom, an aunt, someone in your community who's breastfed, that'd be a great support person for you, because it's someone who's really been there, can help you walk through it.
Makes sense. resources that you could recommend to new moms out there watching or expectant mothers? Are there some good resources through United Healthcare, I'm sure?
Yeah, so the Healthy Pregnancy web, if you get on the United Healthcare website, that Healthy Pregnancy link will take you to a lot of resources and connect you also to a lot of other websites that are out there. And then Childbirth Connection is also another really good website that has a lot of information out there that women can access to see what resources may be out there to help them.
Childbirth Connection, okay. And as we wind up in the last 30 seconds, any other tips to moms to maybe give them some kind of comfort in the final weeks of their pregnancy?
You know, honestly, if you're taking care of yourself and being gentle with yourself, which I would want every pregnant mom, I would want everyone to do, but every pregnant mom in particular to do, usually what's good for the mom is good for the baby. So take good care of yourself, make sure you're getting the things that you need, and let yourself naturally go into labor, and I think hopefully things will go really well for you.
Great. Okay, thanks so much again for
You're
your time, Dr.
welcome. Thanks for
Cassidy.
having me.
Good to see you, and we'll be right back. November is National Diabetes Awareness Month, and thus our next guest, who is the Executive Director of the Diabetes Association in Tennessee, Megan Beasy. Welcome, Megan.
Thank you, Amy.
I know you traveled from Memphis. We appreciate you coming to
I enjoy
Nashville
it.
for this. Good. Give us a brief education about diabetes and why we need to be concerned about it, because, I mean, it seems like it's epidemic.
Yeah, it is definitely a growing epidemic. You know, there are over 30 billion people with diabetes in the world, and billion, and then they actually say about 26.1 million here in the United States, and just about 5 million here in Tennessee. So that's a big chunk of the population. You know, it covers two different realms. We have type 1 and type 2. Type 1 is going to be your autoimmune systemic disease. You know, a lot of people used to refer to it as juvenile diabetes. It's actually, we see patients diagnosed as early as 3 weeks, well into their elderly age. So it's not really an age percentage there. And then type 2 is obviously going to be your environmental controls. You know, your body's not absorbing or taking on the sugar as well as it should. So
Why is it at such epidemic levels?
you know, it could be very much health related. It could honestly just be, you know, we're seeing these you know, earlier ways to detect it, earlier ways to kind of find out about it. You know, there's certainly some different realms to it, but it could just be that, you know, as we eat and sit and don't exercise as much, we're just seeing that growth kind of rise. So.
Do you have a personal interest in this, someone in your family?
I do. My mom was a diagnosed type 1 diabetic. She has been my whole life. She was diagnosed when I was 3 years old, so I've kind of grown up with it. And she was diagnosed originally as latent onset of juvenile, but now we would refer to that as type 1. So really, I've been around it my entire life, watching her test her blood sugar and take insulin and really kind of being in that world. So
there's a lot you can do as a patient to manage diabetes, isn't there, if you have the tools, the education?
You know, it's certainly a manageable disease. Definitely type 2 is, that environmental is really going to be manageable. You know, it's about balancing what you eat. A lot of people say, well, I'm diabetic, I can't have any sugar. Well, that's true in one sense. We like to say it's more about a balanced diet. If you know, you can have that piece of cake on your birthday, but let's, you know, complement it with a nice green salad and maybe a nice 30-minute walk. So there are some things you can do so you can still have that fun and enjoy that time while, you know, doing a little bit of exercise and kind of balancing your day. So
instead of being deprived.
Yeah, we don't want you to
Totally
deprive. A lot of people will, that's where you get into trouble. People will deprive themselves and then, you know, will kind of overindulge, and we definitely don't encourage that. We encourage more of a kind of, you know, take it all in and then balance it out.
Balanced approach. Type 1 is harder to control.
It is going to be harder to control. So type 1 is the basically the total shutdown, your islet cells, and it's a microbiological thing and stuff, but really that's where you're going to go into that insulin dependent. So there's people are going to be the ones that have to deliver insulin, whether through a pump or through shots. They're going to be the ones that really have to manage that diabetes. So
Megan, let's talk about symptoms and then how diabetes is diagnosed. What would some of the symptoms symptoms be?
Well, it's kind of funny. I mean, the symptoms often can resemble the flu and the cold. You hear that a lot, but it also can be like an extreme thirst, very thirsty, dry mouth, and it's almost an extreme point, like really, definitely a kind of sluggish feeling, a little bit lower, harder to kind of wake and stuff like that. You're actually going to see weight loss oftentimes in type 1.
Right.
So you're going to see an extreme weight loss. With my mother, she was so proud of herself. She'd lost 40 pounds and then they diagnosed her. So you're definitely looking for that extreme weight loss component sometimes, as well as you can actually see weight gain too. So, really the best way to do it is going in during your monthly, your regular physical, and talking to your physician about having your A1C checked, your fasting blood sugar checked. That's what you're really going to try to do to diagnose. So
blood work will help.
Blood work will help
lead them to the
that
diagnosis. Go ahead. Treatments. It depends on the type of diabetes, I suppose, that you have and the treatment options that would be available. Let's go over with type 1.
So type 1, again, is that insulin-dependent diabetic. So they're going to be treated through either, injections or a pump of some form. So that's going to be basically, that there are lots of great new devices out there. You see the glucose monitoring and all this fun stuff. They're all sorts of cool gadgets, but when it comes down to it, they're going to have to deliver their own insulin. Their body doesn't create insulin.
But those options and some of those gadgets, if you will, are making it easier for the patient,
Certainly.
aren't they?
Yeah, they really are. They're making it easier for the patient. They're making it easier for the patient's families. My mother, I go back to her, but she has a continuous glucose monitoring system. So it will actually alert me if she goes too low. So I get a cell phone alert and I know, okay, I need to call mom and see, what's going on. Or if she goes too high. So those are definitely kind of peace of mind aspects. So
For
they're
the
really,
family.
and that's something that 10 years ago those didn't exist. So we're really excited to see those kind of come on board in a regular fashion.
Diabetes can be very serious. You hear about some people who may end up having a foot or a toe or something amputated.
Yeah.
So it can be very critical. We want to let people know not to scare them, but this can happen if it's not monitored closely, correct?
It can. It can also happen if it goes undiagnosed. So you can develop diabetic neuropathy. You can have issues with your feet and limbs. It can also give you heart trouble, heart problems, strain on your lungs, strain on your vascular system. There are a couple different things. We really, like I said, we encourage folks to have their A1Cs checked.
A1C. Okay, that's the thing
the
to
key.
remember. A1C. All right. Is there a cure yet? Are you getting closer?
No, that ever-elusive cure. We always strive for it. The type 1 and type 2 are, when it really comes down to it, two different diseases. Type 2 is probably closer to that cure. There are medicines that can really kind of help control the A1C, bring it down, control your blood sugar. And so really, that's striving every day to get a little closer to that. When it comes to type 1, we're still in that kind of looking for all of that. What we can do is talk a lot about the risk test, the diabetes.org. We have a risk test available.
Okay, good.
That you can go in.
Diabetes.org. Okay.
And it's 7 easy questions, and you can take those just to see if you're at risk. And that's something that we try to encourage folks to know that they can come back and forth to that and check it out.
Thank you, Megan. Sorry, we've just run out of time.
No.
Thank you so much. Thank you for watching Community Health Matters. Learn more ways to improve your health at mycommunityhealthmatters.org. And remember, here in Middle Tennessee, our community health matters.